Now, other things that would come up commonly would be like knee pain is very common, and the principles are effectively the exact same as those that I've discussed previously in terms of the modifying the range of motion, modifying the resistance profile, modifying the tempo, the volume, etc. So you do have to really pay attention to those, because I think a lot of people are really hesitant to like cut their squat range of motion short. They're like, oh, but I take such pride in squatting deep, even though the pain is like really aggravated by that bottom position, which is most often the case when people have knee pain. Just take it in your stride, do box squats for a few weeks. That's something that I would use very frequently. Another thing that you can do is, again, modify the resistance profile. So if you're doing a leg press or a hack squat or even a barbell squat, if you use reverse bands or even standard band setups, you can make the exercise more challenging at the top, and less challenging at the bottom, which is going to allow you to continue getting a decent training stimulus without aggravating your knees in that most provocative position. So that's something that could be really useful. Tempo is also something that's really powerful when it comes to the knees in particular, especially if you're dealing with a patellar tendinopathy, so a tendon type injury in the knee. Because if you drop really fast into a squat, there's a real spike in forces at the bottom, and that can often lead to symptoms for people. Whereas if you take 3 seconds down, pause for a second or two at the bottom, that can often be of great help to continue getting a positive training stimulus without aggravating those knees over and over. So there's some of the things that would come to mind. Other things that you can do that are specific to the knees, I guess, here would be, if you're doing squatting exercises and you normally do a real high bar squat or a front squat and you squat really deep, those are more knee dominant in some sense. You definitely work through a larger range of motion at the knee. The knee is taking a bit more force overall. So what you can do is adopt a bit more of a hip dominant squat. So for example, a lower bar position, or sit back more rather than allowing the knees to travel forward and sitting down as deep. And that'll change the muscles that are recruited. You'll feel a bit more in your low back and your glutes and your hamstrings and adductors even, a little bit less in the quads potentially, but you're taking a bit of the load off the knee, and that can allow you to continue training from there. So yeah, there are some of the specific things that would apply to the knee. Of course, again, varies by person, varies by injury, but there's some of the things that I would have clients do quite frequently.
100%. So hopefully that gives people a little bit of an idea of how to deal with certain areas, and also to give them a bit, as you said, like a bigger picture idea of how to deal with this stuff. But I basically have, I suppose, like a kind of a two-part question. So what's the difference between like an acute injury and a chronic injury? And I don't mean like the definition or whatever. I mean, like, how do we deal with this? Like an acute injury, I think people are a bit better equipped to deal with that, because generally they'll hear a pop or a fucking snap or something, and they'll be like, okay, you can take a few days off and then I'm going to ease back into it, right?